Welcome to Adapting Class. Let's continue with our series. We are now on video number 4. I yield fact 4. Fundamental of nursing that you're supposed to know. These are things that comes out multiple times. We expand through infectious control, best care, and comfort, all of them together. We are all doing fundamentals. So let's get to it. Straightforward question as usual that require you to think. Test taking skills. What is the next best action, right? Priority. A nurse is caring for a client in suspension traction. So he's on traction after ankle fracture. I'm underlining the buzzwords for you. The client report of what? The hands and the feet being cold. What is the next best action? This is a concept you have to know. If this is the patient in the bed, and this is the pulley, his leg is in traction. So this is his leg, it's in traction. One leg will be here like that, and his back is here like that. So he's sitting down. This is in traction. Because of the dependent position, okay, certain areas, the peripheral areas are going to be cold. His nose is going to be cold. His hands is going to be cold. His feet, his legs is going to be cold, especially the one that is elevated because they're not going to get blood, blood because of the dependent position. Blood flow there will be difficult. The heart has to take care of all this volume of blood. Therefore, calling the doctor is not good. That's not going to help you. We got to find out why the patient hands and feet are cold. Calling the doctor will not let you find out. Remove the weight on the suspension. Never do that until there's an order. That take away the traction. Check the legs for pulses. Yes, you are looking. Make an assessment and see how much pulse blood is flowing through the leg. You can also check the sacrum and see if there's edema there, dependent edema. That means it tells you blood is not flowing. If you check their nose will be cold. Their hands will be cold. Yeah, that is all because of the position they are in. Tending the client in the bed is going to be painful. At the same time, it's going to affect the traction, but they have to be supine. They can't be turning on their side. Okay, they can do upper body weight lifting, get themselves upper body by moving, but turning them on their side will be painful in terms of the traction. So the best way is to assess for their pulses in their leg. Prioritization. Number 2, all these questions are concept. What is the next best action? The same thing, priority. Okay, you have to be sharp. A nurse is caring for a client who reports of what? Severe incisional pain, immediate post-operatively after appendectomy. Which is at surgery, and they remove the appendix, and all of a sudden it's complaining of abdominal pain. What would you do? Tell the client to take a deep breath. You ask them where is their pain. They told you incisional pain. Let me get you some pain medication. You can't give medication without assessing the quality of their pain. Rate their pain and see how bad so that you can give them appropriate medication. If you need to give them IV medication, you give them. If you need to give them a narcotic, you give them. If you need to give them NSAID, you give them. So how do you rate your pain on a scale of 1 to 10? That is how you answer question and using concept. Number 3, same strategy. Which finding does the nurse document as subjective? Subjective is what? It's not measurable. That's another word you can use. Or subject. That's patient telling you that. Objective is measurable. A nurse is doing morning assessment on the client admitted for DKA. Which of this is a subjective? Potassium of 5.86 is an objective value. You can measure it. SAT, measurable. Chest ratio, athleticism is measurable. I have nausea and abdominal pain. Patient telling you it's a subject. So 4 is your right answer. Number 4. A nurse received report on 4 clients. Which client situation require being seen first? Who need to be seen first? Client with what? Mastectomy. All of them. They have the same thing. Divide it. Look at the situation and see what is happening. Be sharp moment. Right mastectomy and your JP put out 20 cc in 12 hours. That's like little. Right mastectomy and comprehension of pain 5 out of 10. Be sharp. Life, limb, eyesight. That's your only time you worry about pain issue. This pain is not going to kill him. Mastectomy, fill wet sheets on the back. Think about it. You have mastectomy. Why should your sheet be wet on your back? Patient is bleeding. That's bleeding sign. Blood is leaking towards the back. Client with mastectomy feel depressed. This is what you deal with physiological stuff before you deal with psychological. Depression, we have time for you. This patient is bleeding. You got to be sharp. There's no psych issue in a be sharp moment. So number 3 is bleeding. Number 5. A nurse was informed by the charge nurse to make one room available for incoming patient. The nurse should consider which client is best for discharge, who should be sent home. Client admitted for mania for 12 hours. Client admitted for abdominal bruit 12 hours ago. Client with hip arthroplasty ambulating with the walker. Client with pneumonia and SARS of that, 89 on 4 liters. Key fact, key concept to answer this question, stable patient can go home. If you meet all your requirements, you can go home. Mania, 12 hours is not ready. Abdominal bruit, that means what? AAA, aortic abdominal aneurysm. It's going to rupture. You can go home. Arthroplasty and you're walking usually 2 to 3 days. As soon as you start walking, that's the key. You walk and you go home. So this patient should be ready to go home. Pneumonias, 89, south of 89 on 4 liters is not ready to go home. So 3 can go home and we can make the bed available. Number 6. A nurse is caring for a client who is now post-permanent pacemaker placement. Which of the following teaching is appropriate? Keyword, placement of what? Pacemaker. You have to know it's a wire. You put it in your heart, okay? It goes into the left ventricle, right? But they usually, most of the time, they put it on the left side. It starts from the left and come. They can also put it on the right, but you start on the left. Whichever way it goes is fine. The key fact is cell phone should be away 6 inches. Okay? MRI should not be a problem. Yes, it's a problem. It's a wire. Don't use microwave. No, you can use microwave. You should not lift your hand above your shoulder. That means it disrupts the wire. So whichever side they place it, it's going to disrupt the wire. But most of the time, they put it on the left side. So this teaching is appropriate. Number 7. After teaching new graduate on infection control protocol, which of the following indicate correct understanding of the teaching when caring for a client with what? Localized herpes zoster. There's a reason why I put localized, because you have to pay attention. This is a trap question. Before you answer, you have to come with a plan, okay? Varicella, undecimated, zosters, herpes zosters. You have contact and airborne. If the lesion is crusted or localized, it's very small, localized, this is a standard precaution. Don't forget that. Localized zosters is a standard precaution. If it's standard, wear gloves in client's room. Why do you want to do that? Wear surgical mask when providing care. Why do you want to do that? Insist on washing your hand with soap and water. That is no contact. he institutes standard precaution to ensure. Somebody will say, well, I can wear gloves in the client room. There's no need, unless you're going to touch the patient, there's no need to just walk in and wear gloves. I mean, most of the time when you're providing standard of care, you just come into the room with gloves in your hand. If you're going to touch the patient, yeah, that wearing the gloves in the client room, it does not make sense. Wearing a surgical mask when providing care, it does not make sense. Standard precaution. When you need, you're washing some wound, you're doing something, yeah, that's the best thing is stand up. And sure, the question is designed to let you know you get the institute standard precaution. Number 8, the next is to assess the client jugular vein distension, JVD. Which of the following indicate correct understanding of the procedure? So if the patient is in the bed and you want to do JVD, they stay supine, just raise the head up to 30 to 45 degrees. And they have to turn away from you. So supine is all good. Okay, supine is good. Head of bed 90 is too high. Okay. Then, so that is gone. Supine, client head is turned towards the nest. It should be turned towards away from the nest. Head of bed 40, that's good. Is within this range. Client head is turned away from you. That's good. Supine, good. Client head away from you, fine. But I need angle. The head of the bed has to go up. So 3 is your right answer. Number 9. A nurse saw a client on the floor who is unresponsive. Which method the nurse should use? The nurse should use to open the client airway. So you want to you went in, this client is laying on the floor like that. He's not supposed to be on the floor. How will you open his airway? You have to think. When you left the client, he's probably sitting down on his bed. If he's on the floor, he has fallen. So that's 4. That means trauma. If it's a trauma, worry about the neck. If I'm worried about the neck, I'm not moving the neck. So head tilt, wrong. Chain lift, wrong. Chain lift, wrong. Jaw thrust, right. Jaw thrust, right. Head tilt, wrong. Jaw thrust and inline stabilization is this. If the has no fall, no fall, yeah, you can use L-tilt and chain lift. That's the easiest way to do that. So just to help you think critically, that was this question for. And the last one, number 10. Nurse is caring for a client on Nitroprusside for 4 days. Client is weak and with confusion, basically. Which lab the nurse should anticipate the physician will order? Think about it. Nitroprusside, 4 days. Client is now weak and has confusion. Which lab would you order? I told you the pharmacology, this nitroprusside, we only give it for 3 days. And we use it for hypertensive urgency. Okay. When you have toxicity of this medication, you have weakness, confusion, delirium. Why do you have all this? It's because you have cyanide toxicity. And what do you give the patient? Thiosulfate. So this patient is demonstrating cyanide toxicity. Therefore, we should give them, we should check cyanide level and give them thiosulfate as an antidote. This is the end of it. Short 10 questions. I yield back for you, Norma, 4 fundamental. Take care of yourself. So far, you have over 50 questions. I know you're doing well in your fundamental. Subscribe if you don't subscribe, and all the best of luck. Thank you very much.